Welcome back, ladies and gentlemen, to our afternoon sessions. It is time for our first plenary session of GEEF 2023. This session will be on the role of digital health in an era of post-COVID-19 for global health and the SDGs. The session will be moderated by Ms. Hani Kim, who is the Executive Director at the Research Investment for Global Health Technology Foundation, or known as RIGHT Foundation. Ms. Hani Kim, over to you to introduce the panel.
Thank you. I'd like to first begin by thanking the organizer for giving the opportunity to the RIGHT Foundation to serve as the chair. I'm very excited about the discussion that we are going to have. Just a few words about the RIGHT Foundation. We are a Korean nonprofit organization established by the Korean Ministry of Health and Welfare, Bill and Melinda Gates Foundation, as well as the Korean Life Science Companies in 2018. And our mission and the goal are about leveraging Korean strengths to contribute to improving global public health and health equity. So I would now introduce our distinguished presenters and panelists. I will start with those on the floor first and move over to our online speakers. So first, I would like to introduce Dr. Ki-dong Park, who serves as the Director of Data Strategy and Innovation at WHO. Thank you. Welcome. And next, we are joined by the Honorable Minister from the Ministry of Health of Vanuatu, Honorable Rick Mahe. Welcome. And we have Ms. Sune Kim, who represents the Korean Foundation for International Healthcare, KOFI. Welcome. And we are joined by Dr. Gun-ho Na, who is the Director of Naver Healthcare Lab in Korea. Welcome. And online, we are privileged to have Dr. Vasuntara Sibirakos Iengpuruk Sawan, who represents the Asian Development Bank, who serves as the Senior Universal Healthcare Specialist. Welcome. Thank you for joining. And last but not least, we have Dr. Jean-Philbert Nsengimana, who is the Chief Digital Advisor at Africa CDC. Welcome.
Thank you for having me.
So before we go into the main session, I would like to say a few words about the context for why we have this particular session on this topic. So as many of you have noticed, there are many lessons that we've learned during the COVID pandemic, many of them very humbling. Among those lessons, I see a potential opportunity that we could be very energized about, and that relates to the possibility of a new intervention that could truly contribute to improving public health equity globally. Recently, there has been some very compelling papers from WHO, World Bank, as well as the Lancet Commission to highlight the potential of digital health technologies to serve as a useful tool. However, those recommendations did come with a somber cautionary note that while it has a potential to contribute to public health, it also carries the risk of worsening existing health inequalities, because as you know, digital health technologies, in order for them to be useful as tools to aid in public health surveillance, disseminating health promotional messages, it also requires solid infrastructure or highly skilled personnel. So right now, the world community is carefully waiting to establish, through collective efforts, a body of evidence who really points to what it takes to develop and make available digital health technologies, not just as just another commodities to be bought and sold in a market, but as global common goods that could help us improve public health and public well-being within the framework of the UN Sustainable Development Goals. So that leads to the two key objectives of this session. that our distinguished panelists and presenters will educate us about. First objective, can we learn about what different international organizations represented here today, such as WHO, Asian Development Bank, as well as Africa CDC, about their current strategic interests and programmatic activities that they have done to explore the potential of digital health tools towards public health? And secondly, what are the lessons learned? What are the opportunities? What are the barriers? What are the risks before we could fully materialize the potential of digital health tools while mitigating the risks for digital tools to worsen health inequity? So I very much look forward to hearing deep insights from all of you. It's going to be a series of 15-minute presentation of the presenters. We'll start with Dr. Ki-dong Park. We are not going to pause for Q&A. And if I can ask you just to hold on with your questions, we could open up to the panel discussion after all three speakers have spoken. So Dr. Ki-dong Park, the floor is yours.
Thank you, Mr. Hanigin, for introducing me. So I prepared some slides. So it is my pleasure to participate in the session on the role of the digital health in the era of the post-COVID-19 for global health and SDG at the Global Engagement and Empowerment Forum 2023 on behalf of the World Health Organization. Digital health will play a very critical role in turning crisis into opportunity, which is the theme of this year's GEEF, in health-related SDG and universal health coverage. Digital transformation changes the way the society or organization or institution operates. We have observed substantive changes brought by digital transformation, such as digital banking, e-governments, online education, etc. WHO considers digital transformation for health is a game changer of the future health system. Digital transformation in health-seeking behavior is already very common. Millions of people seek medical advice, ask YouTube to get advice for their medical journey. Video is already a powerful tool to make medical content digestible. Today, I'll tell you WHO's digital health strategy and WHO's digital health strategy as well as WHO's recommendation to our member states in developing digital health. Digital health is the field of the knowledge and practice associated with the development and use of the digital technology to improve health. Digital health extends the scope of the e-health to include the use of the big data, genomics, and then artificial intelligence. So telemedicine, wearables, and then mobile apps. Clinical information system, e-prescription, referral networks are a few examples of the digital health. Digital health interventions that may be used to overcome health system challenges. As you see in this slide, for instance, there's an intervention of known efficacy. It is not well utilized in some instances because demand of that service is quite low, as well as individuals' adherence to guidance is poor. In this situation, targeted communication to individuals through reminders or health messaging using simple digital technology may stimulate demand for services and increase patients' compliance. Telemedicine may help to overcome health system challenge of the geographic inaccessibility. I want to say digital technology, digital health, does not exist in a vacuum. Digital health intervention has enormous potential to positive change, such as to improve health outcomes, improve patient safety, healthcare quality, and experience of patients. However, it may also increase inequalities by disproportionately benefiting less disadvantaged people. We call this negative impact as intervention-generated inequality, IGE. This slide shows a result of a scoping review on equity in access, use, and then engagement to digital health solution. The study was supported by WHO European Regional Office. This study applied equity lens using Progress Plus framework. Progress stands for P, place of residence. R, race, ethnicity, culture, language. O, occupation. G, gender, sex. R, religion. E, education. S, socioeconomic status. S, social capital. Plus in this study included age, disability, or complex health need and minority group. The study found that white and English-speaking people with no disability has better access to digital health intervention. People living in urban area, white and English-speaking people, highly educated people with higher economic status, and young individuals are using digital health intervention, digital health tools better than others. We consider people with disability, people living in rural area or remote area, low economic status, and the elderly are disadvantages, and the vulnerable population in accessing healthcare services. They are much in need of the digital health solution to overcome these challenges. Health policy should focus its efforts to address these gaps among vulnerable populations. We believe digital health can play a critical role in this regard to overcome these healthcare challenges. From now on, I will tell you what efforts UN and then WHO are doing to address these challenges. In June 2020, UN Secretary General launched the roadmap on digital cooperation to facilitate positive impact of the digital health technology while tackling negative impacts. The roadmap presented following 8 priorities. 1, achieving universal connectivity by 2030. 2, promoting digital public goods to generate a more equitable world. 3, ensuring digital inclusion for all, including the most vulnerable. 4, strengthening digital capacity building. 5, ensuring the protection of the human right in the digital era. 6, supporting global cooperation on artificial intelligence. 7, promoting trust and then security in the digital environment. Finally, building a more effective architecture for digital cooperation. WHO has the Global Strategy on Digital Health 2020 to 2025, endorsed by the World Health Assembly in 2020. In the Western Pacific region of the WHO, the Regional Committee adopted a resolution harnessing e-health to improve service delivery in 2018. In September last year, WHO Regional Office, WHO European Region, also adopted a resolution leveraging digital transformation for better health in Europe. These global strategies, regional action agenda, and regional action plan are well placed in WHO's overall priorities. The goal of the WHO is the attainment of the highest level of health by all people. We present current top priorities in 5 Ps: provide health, protect health, promote health, power health, and perform for health. Digital health is at the core of the power health. Harness power of the data, digital health, innovation, and partnership. The vision of the WHO Global Strategy on Digital Health is to improve health for everyone, everywhere, by accelerating the development and then adoption of the person-centric digital health solution, and developing infrastructure and application that enable countries to use health data. The vision of the Regional Action Agenda on harnessing e-health is that the use of the e-health, the use of the digital health can give people in rural and remote areas access to quality care, empower patients and communities to engage at all levels of the health system, and provide timely information for the prevention, diagnosis, and management of illness. Common key message of the WHO's global strategy and regional action agenda are people-centered digital health. Having this in mind, WHO recommends its member states to consider the following aspects in investing to digital health. First, digital health should be coordinated to support continuity of care. Second, digital health investment should address a health need, be appropriate to a local context, not duplicate to existing digital tools or systems, and account for long-term costs. Built on these considerations, WHO in the Western Pacific region recommended following priority actions for all countries. These are strategic planning, use of the essential e-health tools, capacity building, cross-sectoral involvement, engagement of the different stakeholders, ensuring privacy and security, sharing of information, expertise, and experience, monitoring and evaluation. As countries are at different stages of the digital health development, WHO provides recommendations tailored to country context. We grouped countries in the region into 4 different categories. 1, countries at initial stage. 2, countries at developing stage. 3, countries at advanced stage. And special category of the countries with small population. For the countries at initial stage, WHO recommends the following actions. First, develop unique health IDs. Digitization of the relevant existing database. Introduce essential tools such as electronic medical records or electronic health record at facility level. And introduce mHealth and telemedicine, etc. These are recommendations for countries at developing stage, and then for advanced countries at advanced stage, WHO recommend first innovative e-health applications, improve interoperability, strengthen privacy and accountability legislation, regulation, and enforcement. Finally, mentor other countries that are in initial and developing stages.
Dr. Park,
Yeah.
you have 2 minutes to wrap up.
Yeah, for countries at the small population, our advice is first assess coverage of the electric power, establish and improve basic e-health tools, and adopt a stepwise approach for investing in e-health. In addition to this, we just assist countries' strategic planning, and we provide guidance on emerging essential e-health tools, and provide training for capacity building. And we are monitoring and then assessing the progress of the e-health in the region. And we are developing, we are reassessing countries' e-health development using digital maturity of the health systems. This model assesses countries' digital health development into two broad categories. One is readiness of the ICT and then information sharing. Second is the readiness of the health system and society. WHO recommends, this is my final slide, the countries to make plan and then invest wisely to support health system needs using digital health. First step would be assess each country's digital health development status. The assessment finding will guide countries to identify priority areas to invest in strengthening essential digital health foundation. It will then contribute in prioritizing digital health tools which target different populations, such as individuals, families, community, and then health service provider, organization, health system. With that prioritized action and then investment, we believe countries' health system can provide quality health services accessible to all the population with special interest, with special focus on vulnerable population at affordable cost. With that, we believe digital health solution can contribute in advancing SDG and then advancing UHs. I'll stop here. Thank you.
Thank you, Dr. Park, for giving us the normative guidelines from WHO and emphasizing the equity lens. We're now going to move to Dr. Vasantara Yengpuruk Sawan from Asian Development Bank. Please go ahead.
Good afternoon, distinguished delegate. My name is Vasantara. I'm representing our team from the Asian Development Bank Health Sector Group. As mentioned in here, our team, Benjamin, our Senior Health Specialist, couldn't join you today, but we have prepared this presentation that I will be presenting on behalf of the team. So in this session, I really have a pleasure to be joining you to discuss the role of digital health, especially in relation to our work post-COVID and the important role of the sustainable development goals. So first, we just want to discuss the background about the Asia Pacific and how it has an issue, but why would we care about the digitalization of health? So first of all, Asia Pacific is lagging behind in certain healthcare delivery, and this is in developing the Asian progress toward universal health coverage. And the progress has been mixed even before COVID-19. So hence, more is needed for USC, especially the role of digital health that can play to accelerate this progress. What we show in this graph is the Sustainable Development Goal and USC indicators pre-COVID. As you can see from here, for both indicator of service coverage index as well as high household health expenditures are quite high in the dark bar graph, which is the low-income countries, compared to lower middle and upper middle income countries. And this has actually worsened during the COVID-19. And now that we are sort of post-pandemic, we're looking for the way to boost this progress. So in response to why would we care about digitalization of health? So health is an important, digital health can be an important social determinant of health. But to ensure this equity in digital health access, we look at two things, both the access but also the use, so that the cost of improving digital inclusion itself are less than managing health illness and health outcomes. To actually manage this though, there are both the direct and the indirect impacts. And the digital literacy and access, as you can see in the middle, we need skills, connectivity, devices, applications, and training and technical support. For support, there's a certain requirements, the IT infrastructure, affordable internet, and the affordable internet-enabled devices itself. For the youth, we look at the digital literacy, the trust, the certain level of support and training to use this technology, and also to have this appropriate and affordable application online content for this. So this all linked to a broader framework of healthcare systems, some of the education, and also the overarching economic and sustainability to enable this. So within the ADB, how does a digital solution become a core element of our strategy? The first one we want to mention is about our strategy 2030. I put in here the link to our digital technology in Asia approaches website, but the key one we want to look at here is operational priority 1, which is addressing the inequality and reducing inequalities. We look at how we can improve the health capital and social protection for all. And within that subset, we have universal health coverage, different level of evidence-based knowledge on jobs, and digital solution is one of that cross-sectoral knowledge platform for these emerging areas in order to be able to reach vulnerable people and also the infrastructure with skill development. So with that, what we access is that the currently a high demand for digital health in Asia Pacific, and what we're looking is about 44% of our venture capital investments in digital health worldwide were in Asia in 2020. But consistent growth in new digital health technologies expected in Asia is actually expected to rise up to 100 billion in value in 2030, 25, and much further and beyond in 2030. There are different categories of the services that could provide. There's a possibility of looking at a wellness and disease prevention. Example of this are the activity trackers and fitness, the screening and diagnostic tool, which is quite important in terms of disease screening and also digital diagnostic and AI imaging. Lastly, the role of care delivery is very essential, and we are looking at different aspects of chronic disease management, critical decision support, and also a different level of be able to provide remote patient support and supply therapies to patients through digital pharmacies. And these have proven very important during the COVID-19 and especially during the isolation period. So the size of the market here, as we mentioned, could rise up to 100%, 100 billion within this time frame, which and this is based on our report, which was done during the COVID-19 on future healthcare in Asia on digital health systems. So the areas of benefit to healthcare, we like to actually discuss this a little bit because digitalization promotes good health governance and directly by improving data availability and information use in health, but also indirectly by forcing better governance overall. So in this graph, in this figure, and also the arrow, you can see that with the indirectly with the governance, implementation of digitalization can drive improvements in data governance. This is through regulation and management and use of data. But also in turn, it's all improved digital health. This has to be done within the government framework and national strategy and with adequate infrastructure. So these are the framework that we're using through the transforming health systems through good digital governance, and we're looking at accountability, transparency, and how it links with law and also with the equity and effectiveness and efficiencies as well. One of the areas which is quite important for the health and the digital health for the ADB is the workforce tasking and automation. So what we're saying here is that the AI can provide some competitive advantage in terms of the diagnostic, administration to improve efficiency and safety. But we by no means say that we replace workforce. What we're looking for is that the data have shown that 36% of activities that could be done can be automated. But what it can provide is the free human health workforce to focus on patients, so doctor don't have to focus too much on our administration and can provide healthcare and social assistance. And that's what we mean by the potential of digital health in the area that we're looking at. The other things that we're looking in a broader term is also how the benefit of the healthcare delivery from this digitalization. We look at how this affects the prevention of preventive healthcare and health promotion and well-being, especially on improved health literacy in the context of, for example, with increasing non-communicable diseases. There's also increased access to healthcare, and certainly now there's an improved transition in services, and also within telehealth, which help to improve coordination of providers. There's a discussion on improved quality, safety, better data, and efficient health financing in insurance coverage. However, we noted that when it comes to in the role of digital technology, we also want to underline that there's potential to address health inequities. So what I'd like to present here is just a little bit about the support of the digital health from ADB. So all this information are on the website. So we are looking at a series of work that we've done both to support critical regional organizations, but also support to government institutions. And some examples we included here are generating and disseminating knowledge through various publications. In terms also as a guideline, the one that we have shown in digital health implementation and guide on the Pacific, we look at a governance on some of the harnessing big data and the potential for this as well. So for the two examples of regional organizations that we have collaborated with, the Asia e-Health Information Network, Standards and Interoperability Lab Asia, this is what we call SILA Asia. But importantly, we also work with government institutions directly. For example, in Nepal, we work with the Health Insurance Board, LAVDIAS on the e-health and electric medical record, UNR, and the India, which is National Health Authority. This has played quite an important role for us in terms of being able to assist our developing member countries to actually improve various areas at different stages as the previous speaker mentioned. What are the areas that we are looking now going forward? We have recently introduced the Health Sector Directional Guide and Strategy for 2030. So what we did is we look at the future direction and how we can put in digital health to ensure equity in 4 main areas, how it links to urbanization. We also take into account the demographic changes. We have a lot to say about not only aging population and the needs for health services, like as I mentioned, the detection of non-communicable diseases, but the youth health as well in some countries, like in the Philippines, for example, population is still relatively young. So we want to look and make sure that we can actually address this demand for different demographic groups. We're also looking at decentralization and regional cooperation and what are the roles that digital health can play. And lastly, as we mentioned in here, because of the role of digital health that could have potential to work with the health, to meet with the health workers shortage, but also how to actually improve the quality and different level of services within the physical constraints in improving the efficient services and insurance scheme. So we would like to leave with a bit of note about the areas of partnership and some of the work that we have done with through the Korea institutions. The area will be divided into 2 parts, our regional and multi-country level technical assistance, and this is including digital health financing projects from 2020 to 24, and including our collaboration with the National Health Insurance Services and also Your Women University. The other program that we have been involved with and still current ongoing as well is support of health outcomes, and in which we produce the technical guidance that I showed earlier on the digital health. Also, With our technical assistance and projects, we have a range of improvement of health information that we target, and that includes support on electronic medical records, digital registry with the unique ID, and also linking the health system, health information system. So we also look at now increase for the next couple of years in facility level information system and payment, and this will link to hospital management of the information system. So lastly, as a concluding note, that we look forward to have a potential to collaborate on different knowledge generation products, country level implementation, and engagement of government institutions. So it's been my pleasure to be presenting today, and have been contact here. We look forward to further discussing, and again, thank you very much for opportunity to be part of the session.
Thank you very much, Dr. Inguruk Sagwan. Now we are going to move over to Africa CDC's perspectives. Dr. Jean Filberg and Sengimana, please go ahead.
Thank you. Thanks for having me and for inviting Africa CDC to be part of this very important GEF forum. 3 days ago, Africa CDC celebrated its 6 years anniversary. It's been a time of fast growth. It's been a time of action to lead and unite the 54 countries of the African Union in advancing Africa's health security. We've been tested by the COVID pandemic at a very early stage of our existence, but we were able to defy the negative prediction that Africa would not be able to survive a pandemic of the scale of COVID-19. In my presentation, I'd like to cover a few points. I want to talk a little bit about Africa CDC mandate because as a new institution, I don't take for granted that everybody knows. Then we're going to talk about our approach to digital transformation, our focus to revolutionizing primary healthcare using technology, the strategic orientation we're taking, some of the principles we are following, and then the emerging initiatives and key partnerships that are going to drive digitalization of healthcare in Africa and how we are thinking about implementation. So in terms of the mandate of Africa CDC, it is summarized in a new public health order. When Africa CDC started and then the COVID pandemic hit, we realized that Africa needs to respond as one. And a uniting order has been established, which focuses on building very strong African public health institutions to represent the priorities of the continent in global health and governance and drive progress on key health indicators. Second important element is to expand manufacturing of vaccines, diagnostics, and therapeutics to democratize access to life-saving medicines and equipment. And this became very clear during the COVID pandemic, where the over-dependence on the rest of the world, especially on vaccines and diagnostics, became a very big challenge for the continent. And we want to be ready next time when a challenge like COVID pandemic hits. The third element is investing in public health workforce and the leadership program to ensure that Africa has a workforce that it needs to address health threats. Number 4 is to increase domestic investments in health, including the domestic mobilization of financial resources, human capital, technical resources, and networks. And finally, is to put in place respectful, action-oriented partnerships to advance vaccine manufacturing, health workforce development, and strong public health institutions. So the context in which the digital strategy was developed, number 1, it's a realization that the continent, the African continent, which is massive in size, 1.4 billion people, geographically diverse, has a number of challenges that makes healthcare accessibility and equality a challenge. I would say that from a perspective of health workforce, Africa has approximately one doctor for 5,000 people, and lagging behind other parts of the world in this regard. EU, for example, is one doctor for 250, US is one for 400. Maybe somebody can comment later on what's the situation in Korea. But that is one of the most important challenges that we need to face. The second challenge is access to basic physical infrastructure, roads, railways, transport, electricity, whereby 47.7% of households in Africa have access to electricity, and a majority of people still don't have access to electricity, which means also that health facilities also have the same challenge. And then another important challenge is around healthcare spending, whereby per capita on average in Africa, it's about $100 per year, where if you compare with the US, 10,000, EU, about 4,000. And the question becomes, how can we leverage technology in ways that can allow us to meet and mitigate those challenges? And then try to also leverage some of the assets that we have. Certain people see demography as a challenge. We choose to see it as an opportunity. The median age in Africa is below 20. And then the connectivity is increasing, more than 1 billion mobile phones active on the continent. And then there is a very vibrant innovation ecosystem where the innovation community is coming up with solutions and applications to the different problems. So the question is, how do we leverage those three to make up for the gaps we have in accessibility and quality, and promote a healthcare system that is affordable, that is accountable, and that is sustainable. So we believe that digital technologies can be leveraged to accelerate the progress towards universal health coverage, which is a SDG objective. And Africa CDC is leading this transformation. A number of things that we are doing at the level of the institution itself to transform Africa CDC into a digital savvy organization, an organization that is very efficient, transparent, intelligent, but also supporting our member states in their fight to make healthcare more accessible, affordable, of high quality, activate the demand, and promote accountability. But there is also a number of areas where we cooperate very closely to promote more interoperability, to increase productivity and sustainability in the projects that we will be doing with our member states. All the while, we are working to make sure that technology improves the speed at which we are able to react to health threats, improves coordination, which is critical when there is a threat looming, and then increase the precision in which our interventions are conducted. A very important focus for us is primary healthcare. 80% of all healthcare interventions in Africa and pretty much everywhere in the world happen at the primary care level. Community health workers, rural health centers and clinics, and we want to see how we can use mobile technology and a person-centric approach to revolutionalize primary care. One of the biggest experiences that Africa has had over the last couple of years is the revolution that has taken place in financial inclusion, whereby 10 years ago, less than 10% of the population in Africa had access to a bank account. But today, almost every adult in Africa is banked. But doesn't mean that they have a bank account. They don't need to have a bank account. As long as they can transact financially, access financial products on their mobile phone, they are also financially included. So we believe that we can emulate the same experience and same success story and transpose it to the health system. And this will actually help also address one of the biggest conundrums that has plagued digital health globally, which is the issue of interoperability. We believe that if we empower people, individuals with access to their health information, then they can be able to move with that. So we call it bring your own data approach, whereby if you go to the hospital, your medical records, of course the hospital will keep a copy, but you also be given a copy of your health data. You move to the lab, the same. You move to your health insurance provider, same thing. You have your wearables, you consult on telehealth, you become the centralizing point of your health data, and that solves for interoperability and removes the need to invest into the massive interoperability infrastructure, health information exchanges that all the countries in the world are trying to build for the last few decades, but very few countries have been able to completely achieve. So we believe that starting late can actually be an advantage for Africa to rethink the paradigm and have a continent where every individual and family can access digital first healthcare services they need and power that revolution by open data standards. I think the WHO representative talked about it, and shared services and tools to enable the digital transformation of healthcare. And the strategic orientation we've chosen to take is to align with global digital health frameworks and standards. So this framework here with 8 building blocks is a framework by WHO that we are following, and we are encouraging our member states to follow the same approach so that we can move together in the same direction and we can be able to benchmark against each other as we move forward. So we are looking at having every country have a clear strategy, a legal and policy framework, using the same or similar principles, invest in workforce, infrastructure, streamline our leadership and governance and management practices, promote open standards and interoperability, build services and applications that solve for the pain points that we have, and then look at funding and sustainability models that will mitigate a big problem of pilotitis that we have, where many e-health projects have stayed or died at the stage of pilot projects. So we are going to focus on 6 strategic objectives externally, and then 2 internal objectives as Africa CDC. I will not go through all of them, but they touch on governance, integration, workforce, global standards and global goods. Again, I think WHO representative talked about DPIs and the roadmap for global digital cooperation. And then infrastructure, connectivity, and promote a homegrown innovation, because digital health is an important upcoming economic sector, and we would like to see our innovators also benefit. Internally, we're going to build a digital delivery and innovation team to coordinate projects, but also build very strong digital expertise within Africa CDC to support the different programmatic divisions. And then we are going to also have internal business processes that are more agile, more intelligent and transparent using technology and data. So some of the value cover innovation, collaboration, national ownership, the move towards leapfrogging, scale and sustainability, being a result-driven organization, and really be able to detect early and respond more effectively to public health emergencies and threats, and have increased access and quality, affordability of healthcare across the African continent. So with those principles, ideas, we have seen over the last 1 year a few flagship initiatives emerging. I would say these are emerging because Although we are a 6-year-old organization, the Digital or Strategic Information Department is going to be built today. We started with other areas of public health, but we realized, especially with the COVID-19, that we need to increase and step up our investments in digital. So hence, I was brought on board to lead the development of this strategy. And as we develop the document itself, we chose to be agile and start developing projects as we move on. So the first project that's about to be launched right now is
Dr.
the Public Health
Nsengiyama, you
Informatics
have 1
Fellowship.
minute to wrap up.
Thank you. So Public Health Informatics Fellowship, a connectivity initiative to connect 100,000 health facilities and 1 million health workers by 2030, build a very strong community of practice, and then organize convening in digital health to promote country ownership. We are going to set up a digital health innovation sandbox to accelerate homegrown innovation, and we are going to be benchmarking our progress annually through an African Digital Health Index. Thank you. Kamsahamnida.
Thank you very much. I have to say, I'm very grateful for all the panelists for, in general, keeping time. It's easier said than done. So now we are ready to go into the panel discussion for the next remaining 20 minutes or so. I would like to first hear from the Honorable Minister Rick Mahe, who represents the Minister for Health from the government of Vanuatu. Honorable Minister, could you just share with us about your ministry's experiences in supporting or developing strategies around the use of digital health technologies for public health within your government?
Well, thank you. Good afternoon, everyone. First of all, let me begin by thank the organizing committee of inviting Vanuatu to be part of such wonderful event to discuss the important issue that we all face. Firstly, let me reaffirm our country position in regards to the topic mentioned. We believe that we are living in a rapidly changing society, and the transformation of our system and processes to a friendly and faster mode is not an option anymore, but it is a crucial need. We need each other more than ever now, than before, especially for us, small island states. Our government have recognized this need and have set up separately a department that take care of all the ICT needs of our country. And we are gradually moving towards the direction to digitalize our whole government system, including the health system. In health, we are currently reviewing our digital health strategy since 2019 to 2021, and not that's been done because the pandemic we all face during the period I've mentioned. In the new strategy plan, we're considering digitalizing and expanding our collection of our vital statistics through the country, expanding our collection of vital statistics through the country, introducing the medium telemedicine, which has been one of the successful stories in our country from a remote place, because our country is not just an island, but is made out of 83 islands scattered along the vast ocean in the Pacific. So having the telemedicine is one big plus to the health system, that we are providing these services to our people. So this is one thing that we've been working on as a nation, as a government, to establish that through the rural community with no roads to get there, but through the ICT, through a good infrastructure of ICT, we can bring the services to those vulnerable people. So again, we digitalize our health information system to link to the small islands, as I mentioned, the main centers to the small islands, and also to include the patient clinical records in our hospitals. Because our country, as I mentioned, is just not an island, but it's 82 islands scattered along the sea. So it's been challenging for us as a government. So therefore, we use digitalized zinc of a public health system is a need, and we need technical input to design and implement the plan, even to meet the SDG as mentioned by previous speaker. Thank you.
Thank you. It's fascinating to hear you comment on that aspect that Dr. Ki-dong Park from WHO has actually illustrated as one example where digital health tools such as telemedicine could vastly improve access to interventions for, my God, 82 island nation. Talk about stretching the limit. Thank you. We are now going to Ms. Ms. Sune Kim, my apologies, from the Korean Foundation for International Healthcare. I understand that the COFI has a huge interest in general in supporting various nations to improve their infrastructure towards public health. So we would be very keen to hear COFI's experiences in perhaps supporting the infrastructure building for efficient implementation of digital health technologies.
Thank you very much. Thank you very much for all three excellent presentations. I learned from WHO, ADB, and African CDC is working on digital health area. It is deeply progressed well. I think it's a very good challenging, but it is a very good opportunities for them. Currently, COFI is focused on health ODA in developing countries in Asia and Africa. But to be frankly, when we think of health ODA projects in developing countries, we are not directly digital health platform to be infrastructure, but we have some projects on healthcare information system. That is include digital health area. Several big hospitals was established by funding by Korean government, and we set up their healthcare information system. But in case of healthcare information system, we need to consider some of aspects. For example, a privacy issue and acceptability of healthcare providers and also community members or community publics. Sometimes we just established healthcare information system itself, no further kind of community engagement to be understood. This kind of information system is so important because peripheral level information collection is so important. Without capacity building to be collected precise, accurate data from the field, the central level data is accurate. That's why we need to bring more people from the community and also healthcare providers to understand what is digital health will be improve your healthcare system and community primary healthcare system in as well. That's the kind of aspect we can consider. Thank you.
Thank you. And of course, we've just heard the importance of not just the health information system from the Honorable Minister from the government of Vanuatu, but Mr. Nsenginama from Africa CDC also emphasized the importance of empowering frontline healthcare workers and how useful digital health tools can be to precisely do that. So thank you for sharing those insights. Now, last but not least, our, in a way, lone representative from the private sector on the panel, and the number certainly does not reflect the huge importance of the private sector, because of course, globally, the private sector truly drives the innovation in research and development. So we will be very keen to hear from you, Director of NAVER Healthcare Lab, of how NAVER sees the role of R&D in digital health, what directions are you headed, and what experiences are you having from your development efforts or implementing efforts?
Thank you, Dr. Kim. It's so nice to be here back at Yonsei. I see all my former colleagues. From the industry point of view, those of you who doesn't know Naver well, I say Korea's #1 search engine company. About half our business is search engine. However, we do have other arms of business, mainly shopping, fintech, and cloud services, and more recently, entertainment, cartoon and music. Healthcare lies on number probably 6, 7, or 8. It's a future business entity for Naver. For the Naver side, we view Naver as a infrastructure in healthcare company. For example, probably many of us in here in South Korea has a great news and interest about the mostly talked about ChatGPT, which is a GPT 3.5 based a chat engine. The company believes that the AI in healthcare goes well in hand because I think it can solve 2 major issues. As the minister and the African CDC mentioned, and the ADB as well, the inequality issue of healthcare by the accessibility and the resources can be taken care by the mobile platform and the AI resource. Inequality lies in more developed countries as well. Here in South Korea and Europe and US, I think the access to healthcare is not really level and flat, so that it can do a leveraging platform as a providing more access to healthcare in developed countries as well. I'd like to lastly mention about the AI technologies. At the company, we currently serve 7,000 senior citizens in South Korea, where every single day, for the single member household, 독거노인이라고 하는데요. We give 7,000 calls every single morning to these senior citizens. The senior citizen doesn't notice that it's a AI calling. It's almost human-like. And we are very surprised to see these technologies are advancing more and more very rapidly. We are fortunate that we live in Korea and we can service in Japan and other Asian countries. I think the nature is the same. We cannot hire more government workers. We cannot put more hospitals, whereas these AI technologies can help the healthcare professionals and the healthcare consumers, our citizens alike. So here in year 2023, I think we are witnessing the first year of the AI-empowered the great changes in social care services and healthcare. So I think it's so exciting to hear and discuss about the various entities and institutions' future plans about how to bring down the inequality in healthcare. I think as a private sector company, with the resources in AI and platform and cloud, I think we can probably work hand in hand with many governments and many companies and many entities alike. Thank you very much.
Thank you. Just putting on my hat as the director of the Wright Foundation, it's always a delight to hear from our industry partners about their commitment to work closely with the governments and the public sector to make sure that their valuable innovation actually is based on value that's linked to public health. So thank you. I think we do have a few more minutes before we conclude the session. And if I may, this is such a rare privilege to be seated with 3 experts who could speak about regional collaboration. So I want to take advantage of this rare privilege and turn to Dr. Ki-dong Park, as well as Africa CDC and Asian Development Bank, to teach us a little bit about what opportunities and challenges you've observed in your own roles to facilitate regional cooperation. And I always look at Africa CDC enviously because Asia does not have an equivalent of Africa CDC. So I would love to hear all three of your perspectives. I'm going to start with Dr. Kidong Park.
Thank you again, Ms. Honey Gibbs. When I see presentation from ADB and then Africa CDC, so I was very happy. Three organizations' direction is quite similar. And the WHO's Western Pacific region and then ADB, so we have a very regular dialogue and to identify common priority areas. We agree this health is common priority between ADB and then WHO. WHO, starting from our advantage, so we will provide policy recommendation and then standard for how to approach digital health. And then I believe the ADB is using starting from WHO standard and then using their advantage and then select investments project which will improve infrastructure and then also interoperability, and then some project can overcome accessibility issues such as telemedicine. And we see a lot of the synergy will occur between ADB and then WHO Western Pacific region. I hope Africa CDC, their direction is also very similar to WHO Africa region. This is my short comment.
Thank you. Dr. Ing Pruk Sawan, you showed on one of your slides wonderful examples of your current work using with not only with governments, but networks. Could we just hear a little bit about those experiences as you speak about challenges and opportunities in regional collaboration?
Thank you very much. Certainly, this is a very good opportunity to have different organizations, different perspective. And as you mentioned, I think the perspective from the private sector is also very important. So I think with the SDG mandate, because we have a range of BMC countries, it's not easy to be able to meet all the needs at the same time. So some countries have more issues with different demographic profile. But what we are trying to do is to be able to get the common knowledge on certain issues that we think could actually bring the next frontier. And for us, digital health is one of the area. But instead of really start everything afresh, we base on this connection, existing network already happening in the countries or in the region to actually support them to provide this technical assistance. Because they are the ones that also have a better link in the country itself. So I think this is what we see as our role, and also going forward, how we can actually strengthen this. And also, I mean, it doesn't work alone, of course. We also partner with the different organizations, international organizations as well, like the Crucial is one of the partner. So I think that that's probably one our challenge to meet DMC needs while actually maintain to make sure that we have this public good knowledge that we can generate to the region and actually globally. Thank you.
Thank you. And let's hear from Africa CDC, who of course has had a much longer history of this regional collaboration and coordination. Please teach us what has worked, what has been difficult that you're still working to solve, that you can enlighten us on.
First of all, I would like to say that regional cooperation is really a must. It's an imperative because we know that a health threat anywhere is a health threat everywhere. So in Africa, whereby every country can put in place its own public health systems to confront threats, we found 6 years ago that there was high time to come together. And I think it's never too late to move in the right direction. We've started the journey. I'm sure Asia at some point you also decide to build something like this, or you have a similar mechanism. But I just want to emphasize that communication, collaboration, and coordination are very, very important to be able to confront our shared and common challenges. And some of the areas where we see cooperation making a big difference, is research and development, innovation, investment, workforce exchange, and many other areas that go a long way to strengthen our health security. I would say that the challenges that we've seen so far have to do with aligning our priorities, because we have different contexts. and being able to align from different parts of the world and focus on one thing. Our partners may have their own view of what they think is the biggest priority from their perspective, but I think we have to talk and discuss and make sure that the cooperation helps Africa address its own challenges. So the African countries and institutions must lead the way in defining what are the priorities on which we want to cooperate with our partners. But so far, the partnership has been great. I would say that when the biggest, challenge, which is COVID-19, hit us, that's where we started seeing that there are fault lines and cracks in that partnership framework because each country resorted to first protect itself. I think we need to do better next time and realize that only by working together may we confront these global health threats much better.
Thank you. So the three key words as a secret sauce for regional collaboration that I noted: communication, collaboration, and coordination across R&D, workforce training, health security, etc. Your comment on the challenge about different contexts, I think this I deeply value, because just as Africa is a large continent with many nations with different contexts, certainly Asia does have its share of diversity and heterogeneity. Thank you very much for your perspectives. So I would like to just say a few words to conclude the session. I personally have learned so much from each one of you. Thank you so much for sharing your thoughts. I think just to, at a very high level, to summarize some of the messages that I think cut across the multiple experts' perspectives is: we seem to agree on the potential of digital health tools. It could be transformative in improving access to essential health services. It could also help us govern health systems more effectively. But I want to now go back on this very powerful words from Dr. Yingpro Sagwan. Digital health is a social determinant. So the success factors to make it impactful in the end are not purely technical. I think Dr. Ki-dong Park also mentioned that digital health is not developed in isolation, in a vacuum. There's a whole array of other non-technical, indeed social factors that will determine it. So I put an extra star next to that statement. So with that, I would like to thank the audience for staying with us for the session, and thank you very much to the speakers and the panelists.
Thank you very much, Ms. Kim, and all the panelists for sharing your insights. So I do research in healthcare myself. So I'm trying to summarize each session based on my takeaway on what I learned. And I guess in my perspective, I was able to hear about some of the ways I should write my proposal, research proposal for this domain. Thank you very much. So we'll have a 15-minute break now. So please stay with us. We'll resume our next session at 3:10, and our next plenary session will be on smart, sustainable, and inclusive cities. Thank you.